Hey everybody, this is Dr. John with the Health Source of Riverton, and I'm here to talk to you about our condition of the week for this week, which is actually infantile colic. So infantile colic is actually defined as, or I shouldn't say defined as, but is diagnosed whenever you've got a baby who consistently is crying for 3 or more hours a day. That's a really good sign that they've probably got colic. Some other things that you'll see is the abdomen will seem distended, just kind of a pot belly going on. Gassiness is a big sign of that. A child that spits up really frequently can be another issue of colic, or reflux, which the two are somewhat related, especially in little ones like that. If you take and bend their knees up so that they're kind of moving their knees up toward their chest, you may find that that baby actually starts to cry even more and almost acts like they're in pain. Those are all symptoms that they may be having colic. And really, at the end of the day, colic is a digestive problem. Things aren't moving through correctly, and there's a lot of potential causes. There can be allergies, there can be dietary issues going on there. There can be imbalances of the bacteria in the gut, but a really common cause is actually that the upper neck or sometimes the middle of their back can actually be out of place from the process of being born. And even a C-section baby, they have to really crank pretty hard to get the baby out of the smallest cut possible. So there's a lot of potential there for displacing things. So what can chiropractic do? Well, first of all, we can adjust that baby, but when you think of adjusting an infant, don't think of what maybe you're familiar with in an adult. It's a very different process. We actually do what's called touch and hold, where we'll actually feel and figure out what vertebrae have rotated, and we put a very light, constant pressure. We don't give the big push like we do for a adult or an older person. And we use about the pressure that you would use to check if a tomato is ripe, and we just hold that pressure constantly on that spot until things shift. So we do just a very, very gentle adjusting with them. Tends to make a really big difference. There are some studies out there. There haven't been a ton of them, but the research is fairly promising that chiropractic care is in fact making a big difference in the crying. There's also some nutritional things we can look at, both in terms of what mom eats and maybe even looking at some probiotics and things for the little ones. So if you've got a baby that is that's crying a lot, not sleeping well at night, and you're at your wit's end, please don't continue to suffer. Get the little one in here. We'd be happy to evaluate them and see what we can do to try to help get past this colic. Thanks. Have a great week.